Hello, I'm Dr. Terry Simpson. Being president is difficult. A stunning 18% of those who become president die in office, 4 of which have been assassinated by bullets, and 4 of which have died from other causes. Would modern medicine have saved them had they had those maladies today? The answer is most of them, yes. The first president who died in office was William Henry Harrison. He gave an inauguration speech that lasted 2 hours. And it was cold, and people said that gave him pneumonia. It probably is an old wives' tale. He really developed the pneumonia 3 weeks later. What killed him was a combination not only of the pneumonia, but the medical treatment at the time, which included bleeding. Yes, they opened up his blood vessels, and the strength he needed to fight off the pneumonia was bled out of him. Just 9 years later, Zachary Taylor was enjoying the middle of his presidency when he decided to have their version of ice cream, which was some cherries and milk. Now, cherries are often blamed for his death, but it probably was the unpasteurized milk that led to his stomach ailments. But how the medicine treated his stomach ailments at the time was pretty bad. They gave him medicine to make him throw up, medicine to give him diarrhea, medicine to quell his bowels, and cupping. You might remember cupping. Michael Phelps didn't work on the president either. He died after 2 years in office. The next president who died from not an assassin's bullet was President Warren G. Harding. Warren Harding is known to Alaskans as the guy who first came to Alaska. And lore is in my hometown of Ketchikan, Alaska, that a bad crab led to his food poisoning. Had he been in modern times, the food poisoning would have been taken care of with IV fluids and some antibiotics. He didn't have either. And so he died, leaving America to Calvin Coolidge. The final president who died was Franklin Delano Roosevelt, the longest-serving president of all. He died of a stroke in Warm Springs, Georgia, but it was complications from his heart that caused it. His blood pressure that was measured was 300/200. They didn't think to treat blood pressure in those days. It was controversial. And as a result, he had severe heart failure, hypertension, and ultimately died from a stroke. Modern medical treatment would have had his blood pressure under control years ago, and he would have lived out his 4th and final term of presidency. The assassin's bullet killed 4 presidents, or was it? Abraham Lincoln was famously shot by John Wilkes Booth at the Ford's Theater, the bullet going through his head and through his sinus. Had he been in modern medical therapy, he would have been brought to a trauma center, undergone brain surgery, probably survived with little or no neurologic deficits. The next president who died was President Garfield. Now, what killed Garfield was clearly not the assassin's bullet, but the medical malpractice. He was taken care of by an old Civil War doctor who renamed his first name as Doctor. That would be like calling me Doctor, but his belief was if we get the bullet out, we can save his life. So poor President Garfield was subject to multiple operations with non-sterile instruments because, after all, the doctor did not believe in the sterile theory. He thought Lister was a kook. By all accounts, this doctor was thought of as a kook too. Poor President Garfield suffered from multiple sepsis from those injuries, not from the bullet, but trying to get the bullet out. When President McKinley was shot in 1901, he was shot at the World Exposition, which was featuring electricity. He was quickly brought from where he was shot in an electric vehicle, not yet a Tesla, to an operating room, which they happened to have on hand. They opened up his abdomen and quickly removed the bullet and sewed up his stomach. President McKinley was discharged 3.5 hours after he was shot. Boy, would the insurance companies love that one. But unfortunately, he died of pancreatitis, which is an inflammation of the pancreas. Today, we would be able to take care of that by intravenous fluids, which they really didn't have then. Sadly, he died days later. President Kennedy is probably the only president who was shot and killed who would not be saved by modern medicine. When he was shot in the head, it was a fatal injury. and those who noted when he came into Parkland Hospital in Dallas that day, he was dead on arrival and there was nothing they could do to resuscitate him. So when we look back over the 8 presidents who died in office, all but one of them would be alive had they had modern medical care. And a couple of them died from medical malpractice. For your doctor's orders, I'm Dr. Terry Simpson. Still not going to have the crap.